Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Plastic and Cosmetic Surgery. Introduction. Surgeons can reshape the appearance of body parts through cosmetic surgery. If you are not satisfied with your appearance, cosmetic surgery might help you look and feel better. This program explains plastic and cosmetic surgery. It discusses the benefits as well as the risks of plastic and cosmetic surgery. Information on the top 5 most commonly performed procedures is also included. Plastic and cosmetic surgery. Cosmetic surgery changes the appearance of certain body parts. Before the operation, these body parts work normally but may not look like you wish they did. The decision to have cosmetic surgery is reached by you and your cosmetic surgeon together. He or she can recommend if cosmetic surgery will be safe and effective for you. You should have realistic expectations about what cosmetic surgery can do for you. You should also understand the possible risks and complications, as well as the cost of the surgery. Most health insurance plans do not cover cosmetic surgery. The cost of the procedure and follow-up care varies. The next 5 sections will talk about the most common cosmetic and plastic surgeries: breast augmentation, liposuction, abdominoplasty, eyelid surgery, rhinoplasty. Breast augmentation. Breast augmentation surgery is a procedure that increases breast size. This is done with the use of breast implants. Breast augmentation surgery may be performed to create fuller breasts. It may also be done to reconstruct the breasts after breast cancer surgery or other conditions affecting the breasts. In breast augmentation surgery, your surgeon may make incisions at the edge of the colored skin around the nipple, or they may make incisions in your underarm region, along the crease underneath the breasts or around your belly button. Your surgeon will position the breast implant under your breast tissue or under the muscle beneath the breast. If a belly button incision is used, an empty implant will be guided to the breast and then filled. Some breast implants are filled with a sterile saltwater solution called saline. Others are filled with elastic gel called silicone. Although your scars will fade with time, they will not go away. Wearing a sports bra or compression bandage may help support and keep the breasts in the right position as you heal. Don't do any strenuous activity for 2 weeks. Breast implants may rupture, may complicate breastfeeding and the interpretation of mammograms. Don't prevent your breasts from sagging as you age. Losing or gaining weight can also change the appearance of your breasts. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Liposuction. Liposuction is a surgery that removes fat deposits from under the skin in order to shape the body. Fat can be removed from under the skin using a vacuum suction cannula. Fat can also be removed using an ultrasonic probe. There are also other methods of liposuction, including using a laser for assistance. Liposuction may be done on the abdomen, arms, back, buttocks, calves, face, hips, neck, thighs. Your surgeon will evaluate the skin at the site where you are considering liposuction. He or she will determine if the skin is elastic enough to shrink after liposuction. If the skin is not elastic, it will be baggy after liposuction. After liposuction, the treated area may look wavy or bumpy. Cellulite, which is the pitting of the skin, may be made worse by the procedure. You will wear tight garments for a few weeks to keep your skin compressed after liposuction. Liposuction results may not be permanent. If the patient gains weight after the procedure, the fat may return to sites where the liposuction was performed. Abdominoplasty. Abdominoplasty is also known as abdomen reduction or a tummy tuck. It is a surgical procedure to remove loose, excess skin and fat. This is done to tighten and flatten the abdomen. It can also remove stretch marks and narrow the waist. A flabby abdomen is due to excess skin, fat, poor elasticity of the skin, stretching of the inner tissue and abdominal muscles. If you are planning to lose weight, you should do this before a tummy tuck. Significant weight loss after the procedure can result in even more excess skin. During abdominoplasty, skin and fat between the belly button and pubic hair are removed. The abdomen will be tightened with permanent sutures. A new belly button will be created through a small incision. You will have a scar along the bikini line. You will wear an abdominal binder to support the abdomen and prevent fluid buildup for 6 weeks after surgery. Eyelid surgery. Eyelid surgery repairs sagging or drooping eyelids. The surgery is also known as blepharoplasty or an eyelid lift. Sagging or drooping eyelids happen naturally as we age. Some people are born with droopy eyelids, or they develop diseases that cause eyelid drooping. Severely sagging skin around your eyes can make you look older and tired. It can also impair your peripheral vision or sight vision. Removing excess tissue from one or both eyelids can improve your vision. It can also make your eyes look younger. The surgeon will make tiny cuts along the natural fold of the upper eyelid. Loose skin and some muscle and fat beneath the skin are removed. The surgeon may also work on the lower eyelids. Right after surgery, you may experience blurred or double vision, tearing, sensitivity to light. Your incisions will be red and visible at first. Scars from the incision may take 6 months or longer to fade. Swelling and bruising, similar to having black eyes, will likely last a week or more. Many people are happy with the results of eyelid surgery. For some people, results of eyelid surgery may last a lifetime. For others, eyelid drooping eventually may recur. Rhinoplasty. Rhinoplasty, sometimes called a nose job, is a surgical procedure that is done to improve the appearance of the nose. Cosmetic rhinoplasty is used to adjust the angle between the nose and upper lip, decrease or add to the size of the nose, reshape the tip of the nose, straighten the bridge of the nose. Most people are able to return to their normal activities 7 weeks after rhinoplasty. If you are not happy with how the first rhinoplasty procedure went, you will have to wait at least a year for a follow-up surgery. The nose can change over the course of the year. Risks and complications. Risks and complications of plastic and cosmetic surgery depend on the type of surgery you are having. Dissatisfaction with the results of your surgery is possible. All surgeries carry the risk of infection or a reaction to anesthesia. Anesthesia is safe. Most healthy people do not have any problems with anesthesia. Some people have mild, temporary symptoms. Risks of general anesthesia include chipped teeth, cut lips, headache, nausea, sore throat, urine retention, vomiting. Complications of anesthesia are rare. They happen most frequently in older adults or people with serious medical problems. Complications include temporary mental confusion, lung infections, stroke, heart attack, death. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There they will cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots. Other possible risks of various cosmetic procedures include bleeding, impaired function, injury to muscles, numbness or changes in sensation, scarring, soreness, and swelling. Talk to your healthcare provider about how these risks may apply to you. After cosmetic surgery, you might need days, weeks, or even months to recover. Your self-esteem might improve after cosmetic surgery, but cosmetic surgery is not likely to relieve depression or other mental health conditions.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Surgeons can reshape the appearance of body parts through cosmetic surgery. If you are not satisfied with your appearance, cosmetic surgery might help you look and feel better. Most health insurance plans do not cover cosmetic surgery. The cost of the procedure and follow-up care varies. The decision to have cosmetic surgery is reached by you and your cosmetic surgeon together. He or she can recommend if cosmetic surgery will be safe and effective for you. The 5 most common cosmetic and plastic surgeries are breast augmentation, liposuction, abdominoplasty, eyelid surgery, rhinoplasty. You should have realistic expectations about what cosmetic surgery can do for you. You should also understand the possible risks and complications. Thank you for using Explain.